You're on the fourth tee. It's a beautiful morning. The birds are chirping away. You address the ball, you swing, you rotate through, and then right there, right underneath your kneecap, that grinding, aching pressure comes back. It wasn't a sharp tear. It wasn't a pop. It was just that dull, nagging throb that tells you that something is wrong, and now it's getting harder to pretend that it isn't. If you're a competitive golfer in your 40s, 50s, or 60s, and that feeling is all too familiar, stay with me right here, because in the next 15 minutes or so, I'm going to tell you exactly why your kneecap hurts, what's actually driving it, and most importantly, what you can do about it. And that all starts today. My name is Dr. Gayan Poovendran. Over the last 15 years, I have helped thousands of golfers eliminate their knee pain without having to resort to invasive surgery. I personally specialize in sports medicine and regenerative medicine treatments, and most of my patients, they've come to me because they've already tried everything else and they got nowhere. I also golf myself. I'm the guy that you probably know who hits one or two absolutely pure drives, and then I spend the rest of the round playing what my playing partners call army golf. Does that sound familiar? You know, right out of bounds, left out of bounds, then left again, then right again, and march back and forth. So when I say that I understand the frustration of something getting in the way of your golf game, trust me, I mean that on multiple levels. Now, some quick and important housekeeping. Everything that I'm presenting today in this video is general medical education. It is not meant to be personal medical advice, and it does not replace a proper evaluation by your physician. What this will be, though, is real evidence-informed explanations of the most common problems with knee pain in golfers and what most doctors simply don't have the time or don't take the time to give you. Are you ready? Let's get into it. Let me start with a patient story. So this is a friend of mine. His name is David. He is 54 years old. He is a 12 handicap. He is a very successful attorney. He is the kind of man who has spent his entire professional life being excellent at things, not just good, excellent. And he doesn't handle "I don't know" as an answer particularly well. He came to me after seeing two other physicians. One told him, "This sounds like arthritis and here's a pamphlet on it and go read up about it." And then the second one, because he was really itching to get something done about it, gave him a cortisone shot. And then they sent him home. Neither one of them asked him a single question about his golf swing, and that was his main complaint. "It hurts when I golf." Now, David's pain was right underneath his kneecap. It was worse when he walked downstairs. It was worse after sitting in the cart for a while. It was getting progressively worse by the back nine. By hole 15 and 16, he was protecting that knee without even realizing it. His trail leg stopped driving through, his follow through ended up shortening, and somewhere on the back nine, he started losing about 15 yards off the tee every single round, and he had no idea why. Now, what David had is something called patellofemoral syndrome. That is a clinical term for this. Your kneecap isn't tracking correctly. And every single time you bend or straighten your knee, it is grinding against the wrong part of the joint. Here's what's actually happening, and this is the part that most people get completely wrong. Your kneecap, or your patella, sits in a groove at the bottom of your thigh bone. Can you see this here? It's like a train on a track. When everything is balanced and working properly, that train glides smoothly up and down every single time. But when your muscles around your knee and your hips start to become weak or unbalanced or tight, that kneecap starts getting pulled off its track. So instead of gliding, it grinds. And this happens round after round after round. Think of it like the grooves on your wedge, right? So when they're clean and sharp, the ball does exactly what you intended to do. But when they're worn out or they're misaligned, you start to lose control in the shots that matter. Your kneecap is no different. And the golf swing, unfortunately, is one of the most punishing tests of patellofemoral mechanics that exists in sports. Now, here's why. The golf swing, remember, is a full body rotational movement that puts enormous repeated load on both knees. Your trail knee flexes and loads at the top of the backswing. Your lead knee, this is the one that takes the real punishment. It absorbs the full rotational force of your body as you drive through impact. So if your hip muscles are weak, or your quad muscles are imbalanced, or if your IT band is tight, that kneecap gets dragged sideways on every single swing. 80 swings around. however many rounds a month that you get to play. This isn't bad luck. It's a mechanical problem that compounds every single time you play. Now, before we get too far, here's a few red flags that mean that you need to see a doctor now, not later. If you have swelling that doesn't resolve, or pain that wakes you up at night, or a knee that locks or catches or gives way, or if you have pain that is steadily getting worse despite appropriate rest, those are not patellofemoral pain. That is not kneecap pain. Those need a proper workup, and probably immediately. So now that I have your attention, here's the good news. Kneecap pain in golfers responds extremely well to a targeted, specific intervention. Lucky for all of us, this is not a you need to stop playing golf situation. This is a you need to fix the mechanical problem situation. And I'm gonna give you a game plan that's for real, not just a pamphlet. So fix number one is strengthen this muscle called the VMO. The VMO stands for vastus medialis obliquus. It is a teardrop muscle on the inside of your thigh that lies just above your kneecap. This is the single most important muscle in whether your kneecap tracks correctly. In the vast majority of golfers I see with this problem, the VMO is weak, and it's not because they're out of shape. Many of my patients are very fit, athletic professionals who like to work out and be active. But the problem is your VMO is chronically underloaded in everyday movement. When it's weak, your outer quad muscles, the ones on the outside, they win the tug of war of your kneecap, and that kneecap, again, gets pulled sideways. That's the grinding that you feel. There's a fix for this though, which is great. It's terminal knee extensions with a resistance band. So what you're going to do is you're going to anchor a resistance band at knee height. There's a link in the description below of the band that I recommend using and the one that I use. What you do is you loop it behind your slightly bent knee, and then you straighten your leg against the resistance. As you're squeezing, squeeze that inner quad muscle as hard as you can at the end of the range. That is your VMO firing. Do 3 sets of this for 15 reps, but do this daily. It is very simple. It is very unsexy, but it is absolutely effective. Fix number 2 is train your hips. This is the fix that most golfers never hear about because we're always too focused on just the knee, but it might be just as important as the VMO. Weak hip abductors and external rotators, those are the muscles that bring your hip away or your leg away from your body or rotate outwards from your middle of your body. Those end up causing your knee to collapse inwards during your swing. When your knee collapses inwards, your kneecap gets dragged off track on every single rotation. So your hip weakness ends up showing up as your knee pain. There are 2 exercises that we can do to address this. Number 1 is clamshells. You put that resistance band around your knees, lying together on your side with your feet together. Open that top knee against the resistance like you're trying to open a clamshell or like you see a clam opening. Do 3 sets of 15 of this, and you should start to feel it deep in your hip. You should not feel it in your knee. Exactly, in your hip, not your knee. Exercise number 2 is lateral band walks. Now, you put your exercise band right above your knees or around your ankles. You get into a slight squat or athletic position, and then you're gonna sidestep from side to side. Do 2 sets of 20 steps in each direction. This is the same band that I'm talking about using for all of these other exercises. There's a link in the description. If you do 6 weeks of these 3 exercises consistently, you will feel a difference. Not because I'm making guarantees, but it's because we're actually addressing the mechanism and one of the root causes of this kneecap dysfunction. Fix number 3 is your warm-up is probably costing you. Be honest. How many of you walk straight from the parking lot to the first tee? Maybe stop at the range and hit 8 drivers to try to find something for today? No warm-up, no mobility work, just straight to full rotational loading. Bad news. Cold muscles don't stabilize joints. A cold, unfired VMO means that your kneecap starts the round already losing. Please, 5 minutes before you tee off. That's the investment I'm asking for, 5 minutes. Do some standing quad stretches, do some hip circles, do 10 slow bodyweight squats, and then do 10 terminal knee extensions with that exercise band. I'm hoping you're carrying it around with you. You don't need to look like you're doing a full gym session. You just need to wake up the right muscles right before you ask them to work at full intensity. Now, this single habit has changed the back nine experience for more of my patients than almost any other intervention that I can recommend. Number 4 is fix your swing mechanics. Here is something that doesn't come up enough. Swing mechanics and kneecap pain are directly connected. There are 3 patterns that we see consistently: early knee extension, limited hip turn, and excessive knee valgus at impact. Now that last one, what that means is that your knee is caving in as you drive through the ball. So if you're compensating for restricted hip mobility by asking your knee to absorb rotation that it was never designed to handle, no amount of exercise will fully solve this problem. You are recreating the mechanism 80 times per round. So what do? Get a swing analysis with a coach who understands the physical side of the game, not just the technical side. If there's a movement restriction that is driving that pattern, that is something that needs to be identified and addressed. The swing is the source, the knee is just where the bill arrives. Now let's talk about the bigger picture, because everything I just shared is real, it works, and it's always the foundation. But some of you that are watching this have been doing the right things for months or maybe even for years. You've done the physical therapy, you've had the injection, and then the pain came back. So I want to speak to you directly, because that experience doesn't mean that you're out of options. It usually just means that no one has addressed the underlying biology yet. Here's how I think about the treatment spectrum. Level 1 is mechanics. It is strength, it's mobility, it's everything that I just covered. That is always the foundation, that is always the root of everything. No treatment in the world holds long-term if that movement pattern that created the problem is still there. Level 2 is targeted conservative care. This is specific, diagnosis-driven physical therapy. This includes manual therapy and maybe even strategic bracing when appropriate. This is not just some generic do some squats. This is focused, structured rehab based on your actual deficit. Now, I can hear some of you out there saying that I've done therapy and it didn't do anything, but if you've only had the generic version, you haven't really had real level 2 yet. There are therapists out there that are really keyed in and honed into what your problem is, and those are the people that you need to be working with. Level 3 is where it gets a little bit more sophisticated. If there is underlying cartilage stress, if there's chronic inflammation that isn't resolving, or there's early degenerative change in the joint, there are biological tools that work with your body's own healing capacity, and these help address that at the source. In the future, I will dedicate full videos to these individually because I think each one deserves a real explanation. So the short version is this though. These are autologous treatments, meaning that we use material from your own body to reduce the inflammatory environment, help support tissue repair, and also restore the biological conditions that allow healing to happen. And here's the important part. This is not just to mask pain. This is to actually address what's driving it. Who is the right candidate? Someone who has genuinely committed to the conservative approach. They are not responding the way they should, and they want to stay active, not just manage their symptoms. Someone who understands that their joint health is an investment. It's an investment in the next 20 years of competitive golf, in ski trips, in hiking trails, keeping up with people half their age. It's for people who are serious and not wanting to have a conversation about knee replacement when they're 68. Who isn't the right candidate? Well, it's someone with severe end-stage joint destruction who genuinely needs a structural solution. Now, I'll always be honest about that because the right answer for you matters more to me than any procedure. So here's what I want you to understand. There is an enormous amount of space between take ibuprofen and rest and read this pamphlet and it's time to schedule a knee replacement. Most people live in that space. We like to call that the orthopedic treatment gap. And that space is full of options that most physicians don't have the time, the training, or the inclination to explain properly. And that is exactly why this channel exists. All right, that was a lot. So let's bring it home. Your kneecap pain is not a mystery. It is a tracking problem. It's caused by specific, addressable muscle imbalances and movement patterns that the golf swing exposes and accelerates over the years. The good news, though, is that you have more control over this than you've been told. And here's what I want you to walk away with today. Number 1, the VMO is the key. Terminal knee extensions with a resistance band daily. Link in the description below. Number 2, your hips are controlling your knee. Clamshells, lateral band walks, 3 to 4 times a week. The same band. 3, warm up before your round. 5 minutes, non-negotiable. And number 4, if your swing mechanics are creating the problem, no exercise program will fully fix it. So please go get a movement screen. And number 5, if you've done the work and you're still not improving, there is a biological reason. And the biological solution for that exists. Do not settle for just manage it. You don't have to. If this video gave you one clear thing to try this week, please subscribe. subscribe to my channel. That's it. That's all I'm really asking for. What I'm trying to do is I'm trying to build this channel to be the most genuinely useful place on the internet for golfers who want to understand their bodies, protect their game, and continue to compete at a high level for as long as possible. Every week, I will give you real information. No fluff, no generic advice, no just ice it and rest it. The next step is yours. Either start those exercises today, no, seriously, today, not after your next round, or reach out to me if you want to talk about what makes sense for your specific situation. I'm Dr. Gayan Poovendran, and I hope to see you pain-free on the fairway.